How you doing, guys? I'm Ken with Safe. We are an app that allows people to show their verified STD status privately on their phone, and it's the easy, least expensive way to get tested. Well, you may or may not know, STD rates have skyrocketed over the past several years. CDC just reported they're at an all-time high for the fourth year in a row. We started out with this very simple premise. We're just going to make an app that lets people show their verified STD status on their phone. It sounded pretty simple. As we started digging in and peeling back the layers of the onion, we realized that health records in the US are in these completely siloed, disjointed systems. So the first thing we had to do was tie in with a number of different patient record interoperability platforms. Luckily, the ONC had spent about $7 billion of our tax money to incentivize the industry to go to electronic health record systems, and then ultimately to adopt common frameworks like FHIR to allow for interoperability. The next thing we had to do is get deals with Quest and LabCorp, the two biggest labs, which gives us 30,000 locations across the country where people can book testing right through the app. We had to do HL7 integrations there, which is this health patient record protocol that's from the dark ages, not far from mainframe. So that was a big pain in the butt and took about 4 or 5 months to do. From there, we wanted to allow people to book testing through the app and pay for it with their insurance. So we built out a national physician network. We now have physicians that are licensed in all 50 states. In the app, there's a little asynchronous telemedicine piece, basically a questionnaire that allows people, or basically mimics a physician consultation. It's technically backed by a physician licensed in the state where the user is, so that we can chart medical necessity and basically prescribe the testing so that insurance will cover it. We then stood up a mail order pharmacy out of Nevada, so we have a national e-prescription delivery service. So basically, in the process of trying to accomplish this very simple concept, we ended up building a fully integrated virtual healthcare platform. We now needed to make sure that it was incredibly secure, being that we had arguably people's most sensitive health records with their STD status. So we decided to, first of all, anonymize the patient records, de-identify it from the actual individual's names, and then push it out onto a private hyperledger, which we stood up in the Azure cloud. From there, we started talking to the dating apps about putting the Safe badge on the user profiles, so that that would show that the user's been tested within the last 6 months, and they could prove it if they want to, not their actual status. So we started looking at different ways that we could accomplish that, and really, again, kind of came back to this distributed ledger technology concept. So we rolled out a semi-private, enterprise-grade Fabric Hyperledger that just has the user's phone number as their identity marker and the date that they were last tested. We cached it in memory so that the API was really quick, and we're now working with some of the biggest dating apps to add this Safe badge to user profiles. So it'll be lit up if the user's been tested in the last 6 months, and on 6 months and a day, it goes to inactive and is grayed out. So the idea is that it'll drive sort of awareness that this is available, and force people to some extent to get tested more frequently, which all the public health folks say is the most useful way to sort of reduce these spiking, STD epidemic going on here. So the way to allow this to become ubiquitous, we couldn't force people to get tested through the app, or you'd have a large number of people that just wouldn't do that. It's asking them to change too much behavior. So the data integrations that we did through Sequoia Project, eHealth Exchange, and Care Quality give us access to about 92% of patient records in the US. Epic, Cerner, Kaiser, a lot of the big players are part of this framework that uses FHIR in the backbone. And through that, we're able to allow users to basically import the results from anywhere they were tested, any physician, clinic, or lab. And it updates their status with the date they were last tested and their status across the different STDs. They can also schedule testing, as I said, at over 75,000 locations between Quest and LabCorp that uses the phone GPS and shows them labs that are available near them. It allows them to skip the doctor and go directly to the lab And again, through the little asynchronous physician questionnaire, it allows us to chart medical necessity and actually process the claim through insurance, so it's basically free or copay for the end user. We also have the e-prescription delivery component in partnership with McKesson. Through that, we did an interface with SureScripts, which is basically the industry sort of framework for e-prescribing, and it's connected to basically every pharmacy in the country. We can also e-prescribe into our own pharmacy and have it delivered overnight. The idea there is we're focusing on chronic infections, people that have to take things like Valtrex. Their physician, if they're nice, will prescribe it to them for 4 months, most of the time 3 months, and then they actually have to go back physically in to do another doctor's visit, to get the renewal for their prescription. This is obviously a very time-consuming, emotional process that has to be done every 3 or 4 months. So we're able to replace that, again, with a little questionnaire that mimics a physician consultation and asks the same questions that the doctor would ask in an in-office visit to basically give them the renewal for their prescription. So it saves the end user a ton of time, hassle, and sort of emotional resonance, and it saves the insurance companies a lot of money. Billing codes for in-office visits are around $180 compared to a asynchronous telemedicine billing code at $40. So there's a big savings there also to the insurance companies. So more than an app, we say SAFE is a movement. It's a coalition of influential people that are on a mission to disrupt the spread of STDs in our lifetime. They were on their way down rates about 4 years ago, and with the advent of the dating apps becoming pervasive. Oh, okay. So we're doing these safe space activations. We have our first one at Sundance this year. We've got Cardi B, G-Eazy, Machine Gun Kelly performing. It's basically a way that we engage influencers to participate in spreading the message about SAFE. So anyway, thank you very much.